Dr. Oksana Hagerty is an educational and developmental psychologist who serves as a learning specialist and the dean of the Center for Student Success at Beacon College in Leesburg, Florida, the nation's first accredited college or university dedicated to educating neurodiverse students with learning disabilities, ADHD, dyslexia, and other learning differences. Hagerty specializes in academic support, cognitive abilities, learning disability interventions, and educational and developmental psychology. Dr. Emily Knight, MD and PhD, is an assistant professor of developmental behavioral pediatrics and neuroscience at the University of Rochester Medical Center in Rochester, New York. Dr. Knight's clinical focus is providing patient-centered subspecialty care for children and adolescents with a wide range of neurodevelopmental disabilities. She also conducts research that aims to understand neural mechanisms of sensory perception in individuals on the autism spectrum. Dr. Kimberly Mosca is head of school at Tribeca Preparatory School, a 12-month independent special education, early childhood, and elementary school in New York that prepares their students for a less restrictive environment by developing their academic and social skills. Mosca is a licensed behavior analyst, a board-certified behavior analyst doctoral, and a certified special education and general education teacher. And we're going to start our conversation with Dr. Hagerty. What is early intervention and how can it benefit neurodivergent children?
In the strictest sense of this word, early interventions are supports and services that are provided to children under the age of 3. And this can be speech therapy or physical therapy or any other supports that are needed to the children and families with neurodevelopmental disabilities. However, I work for a college, and it may be a very interesting combination that I'm here to talk about early interventions, but I wanted to expand the knowledge of the concept of early interventions to just say that early intervention would be any intervention that is done during the critical or sensitive period of time, because when we talk about, for example, college students, we do see that those students who didn't have reading interventions during their first or second grade in elementary school are lagging behind. So to me, if we're talking about the strictest sense of the word, early interventions are interventions done before the age of 3. In the broader sense of this word, these are any interventions that are done during sensitive or critical periods of time of the development, and it can be reading interventions or social skills interventions. It can be any interventions done between the birth of the child to the probably late adolescence, if we're talking about executive functions.
Thank you, Dr. Hagerty. So, Dr. Knight, what is the most recent research showing about the efficacy of early intervention for neurodivergent students?
Yeah, so we know from research that early childhood is a period where the brain is growing and has really enormous capacity for change. And so what we have is a wonderful opportunity to support that brain development with early interventions. And what our research is showing is that targeted early interventions are associated with improvements in some really key areas for neurodivergent children. For example, we may see improvements in language, play, joint attention, and daily living function. And as Dr. Hagerty referenced, even beyond the child themselves, early intervention plays an important role in helping support the whole family and parents. And so when families are connected to interventions and feel empowered to advocate for services, they report that they feel less stress and they feel better equipped to support their child's development.
Thank you. So, Dr. Mosca, what are some of the learning and attention issues that these neurodivergent children are facing that would require early intervention?
That's a really great question. A lot of the early signs are things that we might not really think of. So a lot of times there are in the past couple of years, there's been things you might think of lack of eye contact or maybe repetitive movements such as hand flapping. But really, there's really 3 areas that are very common in developmental delays that signal us that a child likely needs some intervention. So the first area is in the area of communication. So that can really span from receptive language of not being able to respond to one's name to even further on in development in the lack of ability to read social cues and be able to change topics. So some of our families have a hard time thinking that there is a communication issue because they'll say, well, Billy can speak about dinosaurs for hours. But that is an issue in pragmatic language development. And some of these children actually are speaking before the age of 3. And that is an area that is very difficult for families to often identify because they might actually have a pretty robust vocabulary. The children that have a little bit more obvious signs of not being able to respond to their name, follow directions, or say their wants and needs, those are signs that parents typically see a little bit earlier. Another area is with frustration tolerance. So children tend to have a harder time soothing themselves, and parents notice that the tantrums might last longer if the child doesn't get something just the way they want it. And oftentimes it seems kind of like a strange reason. So it might be parents are asking themselves, I just don't understand why is my child upset? With that being said, they might also have difficulties being soothed by themselves, so self-soothing, or by a caretaker. So a lot of times as parents, we're taught, to rub their back or coo or do things to make them, our children calm. But a lot of times these children aren't able to calm themselves with those typical kind of ways of calming a child. And the last area, which is really is a sign that children do need help, is the delayed acquisition of daily living skills. So that can include toileting, brushing teeth, eating, dressing. So these skills are typically skills that children learn through imitating their caretakers. And they, at a certain age, you hear that a child wants to do something on their own. So a lot of times our children might have delays in those areas, and those skills have to be directly taught to them and then repeated. So those would be, I would say, the 3 big areas that families should be looking at.
Well, thank you. So Dr. Hagerty, can you give us some examples then how early intervention can help to mitigate and remediate some of these issues that children who are neurodivergent might experience during this particular developmental time?
In these recent years, and since we're college specializing on working with students with learning and attention issues, there has been research that supports the point of view that specific learning disabilities can develop in response to an extreme lack of environmental stimulation early on. So any kind of deprivation early on will eventually lead to will eventually lead to a specific learning disability, or may lead to a specific learning disability, especially if other factors are in place. For example, if I were to talk about the reading disability, specific reading disability, I would say that interventions started during the 1st or the 2nd grade are most effective. And what they do, they improve the efficiency and automaticity of reading skills that really create the reading experience for the students, that prepare them later on in their life during their teenage or adolescent years for reading comprehension. Because what we're very often seeing, students who were not taught to read properly during the elementary school years then develop reading comprehension difficulties, not necessarily because they lack fluency, but because they lack vocabulary or background knowledge. And if there are no early, and again, I use the word early very broadly, because when we talk about reading comprehension in teenage or adolescent years, we're talking about strategies, which is executive function. So if there are no executive function interventions for students who are reading during 9th, 10th, 11th, 12th grade, they do not develop the strategies that they need. So in this sense of the word, we need to really know the sensitive periods for the development of each ability, in this case, academic ability, and provide interventions that will create brain structures to support the acquisition of the skill and the practice of the skill. And this will create a learner who is capable of performing tasks at an expert level.
All right, so Dr. Knight, can you give us a look at what early intervention looks like as far as helping kids develop social skills and be able to develop relationships? How does that look, the kinds of processes involved with that?
Yeah, so social interactions and forming relationships are actually some of the most complex and nuanced things that we do as humans, even if we aren't really thinking about it. And so, because of that, early in life, it is important to establish a strong social skill foundation that we can continue to build on. And what early intervention will do is meet the child where they're at and help build from there these foundational social skills. So, for example, early intervention will often target things like building joint attention, where the child and an adult, or maybe the child's peer, are both focused on the same activity. And we can also see better imitation and back and forth play skills developing. And then when children have mastered some of those basics, we also begin to layer on teaching children about the different types of social interactions and relationships if they're not picking them up more intuitively. And all of these are really important because they are over time going to lead to increased socialization, increased connections, and more and more learning opportunities going forward.
So, Dr. Mosca, what are some of the challenges parents might face trying to acquire early intervention for their children?
Yeah, so unfortunately, there can be quite a few challenges. And the first one is really in the identification of the need for services. A lot of times, parents might not know what to look for. But, once that is established and diagnosis is established, some of the common difficulties is that it can take a lot of time. So, as Dr. Hagerty said, in the early sense, kind of official sense of early intervention, we talk about the ages of 0 to 3. And for example, in New York City, if a child's diagnosed with autism, they often have, they're often allotted 20 hours of applied behavior analysis therapy. And that's a lot of time. One of the biggest difficulties with early intervention is the age itself. So knowing as adults, it's hard sometimes to get everything into a day. You have a young child, they need to nap. They need to eat. They could be cranky. They might get up late. They might not sleep well. In addition to those 20 hours, a lot of times they have additional therapies that they need, such as speech and language therapy or occupational therapy. And another thing that can be difficult for families is that those therapies tend to happen during normal work hours. So a lot of times families have difficulties with who is going to take the child, or sometimes even the services are in the homes, but a caretaker has to be available. So that brings us to another issue. Even though in New York, a lot of services are covered by early intervention, the cost of having one parent not being able to work if you're a 2-parent working family, or having to hire a nanny or one caretaker to take care of the child during those times. One of the things that was also brought up earlier is early intervention services are really to teach the family. As you can imagine, these are young children. And really the most important is that our families learn the techniques that are needed to be able to care for the children and make sure that everything is really consistent for them. So I would say, again, those are two of the biggest challenges. And the next challenge, and which I think is very hard for families, is once they get the diagnosis, and the services are allotted to them, it becomes difficult sometimes to find providers. Unfortunately, we have a large demand for providers, and sometimes it's hard to find someone. If it's home therapy, maybe it's hard to find someone who come to your home, or there are certain early intervention centers, but depending on the time that your child is diagnosed, there can be a wait time. And that is so hard for families, imagining that your child needs something and you're not able to get it immediately for your child. So I'd say there are many challenges, but those are 3 of the largest challenges.
Well, thank you. So, Dr. Hagerty, you come at this from a different vantage point because you're a college administrator, so you're seeing a lot of this on the back end of the spectrum. But I'm wondering, Can you talk a little bit about how early intervention can help to prevent more serious mental health challenges down the line?
Yes, and I was very passionate about this topic, and thank you for inviting me, because I probably, as my colleagues see it with early childhood, I'm seeing it with adolescence, and I'm seeing students with dyslexia, and they're all very different. And by that time, by the age of 18 and 19, a lot depends on the developmental history. Not so much the neurobiological history of this person. And we know that 25 to 50% of students with early word reading difficulties have poor vocational outcome when they graduate from college, if they graduate from college, because they also have lower graduation rates. So this very early skill that is built during the first or the second grade of elementary school has this profound effect on the probably the entire life of the individual, because again, vocational outcomes are lower, graduation rates are lower, higher rates of psychiatric disorders, mental health disorders such as generalized anxiety disorder, depression, test anxiety. We're seeing a lot of that, and also more involvement with justice system, unfortunately. So that very low level skill that can be remediated easier during the first and the second grade of elementary school has profound, if not remediated, becomes a lifelong condition and has profound effects on the outcomes at school and beyond school. So I cannot emphasize enough the importance of early interventions, although for me it probably should be a little different. I'm a college administrator, but I do see that early interventions do create a lot of change and a lot of positive development. And essentially the success rate is 0.4 to 0.6, which is quite high for educational interventions. So I would say the earlier you can expose your child and afford services and supports to help remediate neurodevelopmental disabilities, the better it is.
All right. Well, thank you. So, Dr. Nye, let's say that we're a family that has recognized the red flags and enrolled our child in early intervention. How can you, as parents, then begin to gauge and assess how your child is progressing in the early intervention program that they're enrolled in?
That's a really great question, because parents are really a central member of a child's care team. And all effective intervention will first begin with an assessment of the child, but then parents working together with providers to define some individualized goals. And we want those goals to be clear, we want them to be measurable, and we want them really to be meaningful to the family and the child. And so parents can see their child's teachers and therapists as a useful resource, and they can and should ask for progress updates toward those goals. Another key question that parents can ask of their child's providers is how they can reinforce the skills that are being practiced in early intervention. So therapists can guide families on how to incorporate learning opportunities into everyday caregiving activities and capitalize on those teachable moments that we encounter all the time. And what that will do is help the skill building from early intervention generalize to our everyday life, which is ultimately what we want to see for the children that we engage in intervention.
All right. So, Dr. Mosca, the next question, I guess, is let's get down to brass tacks. How can parents advocate for early intervention for their children? And does the type of approach the parents need to take vary depending on the type of learning or attention difference the child has?
Yeah, that's a great question. So first and foremost, you do have to become an advocate, and it really starts from the beginning and with the proper diagnosis and identifying different, red flags, different things going on. And one of the things, when we say advocate, sometimes we feel like that word means fight, that you have to be a fighter from the beginning. And that's not necessarily what I'm meaning, especially from the beginning. A lot of times we think of our doctors and our pediatricians as the know-all of our child. But it's really important to know that there are many signs that we see that don't just happen in those 15 minutes that the pediatrician is in the office. So one of the first things I say to parents is know the developmental milestones, know what you should be seeing for your child. And if anything you see is missing, speak up. Don't just, a lot of times we'll say, well, he doesn't do this, but he does do this. Anything you see, definitely speak up and be that advocate. Sometimes the doctors might not ask certain questions at the meetings or at the appointments. So really right there is where you become an advocate. And again, it's not the fighting sense, but knowing what it is that you should be bringing up to your pediatrician. Once you get that diagnosis, again, that can be difficult in itself. But I really encourage parents to become a knowledge seeker. And that is where your true advocacy is going to start. It's hard. You have a lot of experts in the field, or it could even be family members or friends or different people who will give you their opinion. My best recommendation for families is to find people who have done this before, parents. One of the great things with this era of social media is it gives parents the ability to connect to people who they might not have been able to connect with before, who've gone through the same thing. We have a lot of children now that are going through genetic testing that possibly or previously were diagnosed with autism and still might have autism, but we're finding have other genetic disorders. And it could be one in, I don't know, maybe 1,000 or 5,000. And there might not be anyone in this area who has that same genetic disorder. And families are really being able to connect with each other in Facebook groups or in different forums. And it really helps families feel connected. And what I've found is that families and parents want to support and help other families. You're not alone. There's a lot of people who've gone through the process, and you don't have to, in a sense, create your own path. So I think that's a huge connection. Another group of people that really can be helpful in identification and then further along supporting are educators and teachers. So a lot of times if your child goes to daycare or a babysitter is one of the first third-party people in your life that spends a significant time with your child. And they also typically have had experience with children around the same age. So be encouraging to them. If they notice things that they might say, hey, Billy isn't jumping, or I noticed that he has a really hard time when we leave the park. A lot of times it's really hard for these people to say something to the families, but I really encourage them when you approach things with empathy and care, it is really helpful. And as a parent, knowing that no one wants to highlight things and make things worse for your child, they're really trying to help. So knowing that it is helpful. Now, I know Dr. Knight brought up that as a parent, really advocating to get progress once your child is in early intervention and the therapist. And that's really something as our school here, Tribeca Prep, but also really special education law requires that you do get progress updates on your child. And one of the things that's interesting when we're talking about advocating for services, I also really encourage our educators and therapists to advocate when a child has made so much progress that it's time to discontinue services. It's kind of a funny thing to talk about when we're talking about advocating for services, but really it's the educators and the therapists that know that, yes, this child can do it. They've met these skills and we've filled in the gaps. So as educators, we really need to be an advocate for that as well.
All right. Well, thank you for that. So, Dr. Hagerty, as we've been having this conversation, it occurred to me in my preparation for our conversation this morning in reading about early intervention, one of the things that they would say in the literature is that early intervention helps the child reach their best potential. And to me, potential is a very loaded word because that can mean so many different things to so many different people. What does best potential mean, in your opinion, when it comes to early intervention?
Um, this is a good question because, again, I'm looking at this question from the perspective of 18, 19, 20-year-olds. And I would say that the best potential is when you achieve everything you have to achieve during preschool years, during elementary school years, middle school years. And all of that is not the end, it's the beginning. It's the preparation for your adult life. So all those skills that you're building is the preparation for your adult life. When you turn 15 or 16, your potential will be expanded. I don't want to use the word limited. It's or framed maybe by your executive functions, the goals that you will set for yourself, and the strategies that you will use across time to reach those goals. So the potential is what you can do, given that the interventions coming from the educational system are appropriate. This is the potential of the child. It's not just the development of the child, because we're talking about students with neurodevelopmental disabilities, with delays. We're talking, so in this regard, the potential is what you can do, not alone just for development, but with the help of educational interventions, medical interventions that will help you achieve what you can achieve in this society. This is my view of the potential of the child.
All right, thank you. So, Dr. Knight, children, for the most part, aren't going to live in a cave. They're going to have to become world citizens and live as part of a community. So, I'm wondering how early intervention can help improve that child's sense of belonging in a community.
Yes, I love this question because this is really the ultimate goal of what we're trying to achieve with interventions, both early in life and throughout the lifespan. The goal is not to eliminate neurodivergence, but instead to support inclusion and connection within our communities. And so when we give children and families tools early on that help improve communication, socialization, behavior regulation, executive function, we can reduce barriers to inclusion. And really importantly, we can give children a sense of early competence and confidence that allows them to participate more fully in our community. And so when children are experiencing these early successes in their learning, when they are connected to their communities, and when they're forming these positive relationships early on, they are also going to be at a lower risk for some of the self-esteem or mental health concerns that we talked about later in life. And they can really contribute a unique and valuable perspective to our communities and schools and jobs environments going forward.
All right. So, Dr. Mosca, you get our last question of this conversation. It's simply kind of a summation. Can you provide us some closing advice for parents who are rearing neurodivergent kids from, let's go from 0 to 5, who are considering early intervention for their child?
My best advice is go for it. You know, I think as a parent, I had one of my children did have early intervention. And one of the things I didn't realize as a parent, and actually also as a special education administrator, I missed some of the signs. I didn't realize that he was having gross motor and fine motor difficulties. I thought he was just a really quiet and calm little boy. So first and foremost, the stigma of having a child that you feel needs services, you kind of have to throw that out the window. And it is hard, but it's also important to know that getting services does not mean that your child will have services forever. They might, and that's okay too. But really knowing that some of these services are really provided to help remediate and help fill in some gaps. The other thing and I know I keep saying that, but really know milestones, developmental milestones. And there is a spectrum of ways that we deal with things as parents. Some of us might see every catastrophe or everything a child is doing as a possible sign. And then sometimes we might be talking ourselves out of it. Whatever it is, it is okay. and asking your doctor and speaking up is really important. I will say one thing that is very difficult is knowing where to get the services or what services your child is eligible for. So as I said before, connecting with families. But I actually think the best advice I can give, because sometimes you'll go to your pediatrician and they'll say, oh, maybe you should wait another 6 months, or they might not seem as concerned because they might not visually see things in the office. I always recommend calling your local school district, because they typically, if they don't evaluate for early intervention up till 5, a lot of times in New York, it starts at 3 years old, that school districts take over the evaluations. But if not, they'll point you in the right direction. Schools want children to do well, even if they're not sitting in their kindergarten seats at that time. Schools can really be a big help. The last thing I want to highlight is that a lot of times children who present with more significant delays, that are either visual or that are not speaking at all, we tend to identify a little bit earlier. It is important to know that even though some of these milder signs of frustration tolerance or daily living skill difficulties or really perseverating and focusing on one topic, it can go without notice for a while, especially if your child's home. So we saw this a lot during the pandemic. And then when children go to their first school setting where it is more structured, that's where they start having difficulties. So know that although it might not be identified earlier on, they are still just as important to be able to get services for your child. So my last piece of advice is take a deep breath. And a lot of people have gone through this before, and enjoy your child and where they're at, because each stage, no matter what your child is going through, really is a gift.
All right, well, that's going to have to be the last word today. Thank you very much for joining us, panelists. Dr. Oksana Hagerty.
Thank you.
Dr. Emily Knight.
Thank you for having me.
And Dr. Kimberly Mosca.
Thank you.
And thank you for the knowledge.